Today we are here for the launch of 4 films that our second year students have made for NHS Solent as part of their Mental Health Awareness Week. The assignment was part of our TV business and unit practice, where the students get to work with a number of clients on live briefs. They have to budget for it, find contributors and deliver to the clients. And it really is an opportunity for them to put their professional practice to the test.
I'm Dr. Thomas Richardson. I'm a clinical psychologist. I work in the mental health recovery team in Portsmouth and St Mary's for Solent NHS Trust.
One of our videos is about something called dialectical behaviour therapy, or DBT. So this is something designed for people with emotionally unstable personality disorder, also known as borderline personality disorder. So people who might be quite impulsive, quite emotionally up and down, and they might feel suicidal or self-harm at times. So DBT is an intensive treatment to try and give them skills to cope with these emotions and reduce the levels of impulsivity and self-harm. The other one is about cognitive behaviour therapy, CBT, for post-traumatic stress disorder. So that's something that we often do here. People who experience traumatic incidents like abuse or car accidents, witnessing violence, war. It's a therapy to try and help them reduce the symptoms of PTSD.
Our pitch was that we wanted a patient's story, so it was more personal and emotional, and we wanted his journey from the beginning of what he felt like to what he felt like during the therapy and then what he felt like at the end.
I really enjoyed it. We made really good friends with our clients because we made sure to make it quite personal, like we'd call them, they could message us whenever they wanted, email. We had lots of meetings, and when we would go and film with them, we wouldn't just film and leave, we'd hang out with them, get to know them, to make a better film and just to make them more comfortable so they could open up a bit more.
I think the biggest learning curve for us was going out into the real world and working with real clients, because we've always done things together and done small projects within university, but actually having a big client and knowing that this is like real life is just, yeah, it's been different. Solent honestly do support us so much. The fact that they've been able to connect us with clients, the fact that they've been there for us and with us, supporting us, obviously the university help us with kit and all these things, so it's actually been really easy.
My name is FINNEY and I'm here today after doing a video about PTSD with Solent University. They've been absolutely brilliant. It was quite challenging subject matter, and it's at times quite distressing for me to speak about my experiences. They were wonderful, they really stepped up, they were incredibly mature, they were very supportive, they were very, very kind and understanding, and they made me feel completely comfortable throughout the filming process. I can't praise them highly enough.
I think the videos are brilliant. I'm really happy with them. They're really realistic and compassionate portrayals of how hard it is to go through therapy, but how really life-changing it can be if you get through the other side. And that's what I wanted it to say. I wanted it to be a realistic depiction. I don't want it to be just like a sales pitch where everything's fine, because therapy is hard. But I think these really show how, if you do put in the work, that it can be really helpful. So I think they're really well done, they're very concise, and they really illustrate the point well.